So the title of my talk is Everybody Has Won and Almost Have Prizes. And I'm going to skip through some of the background because we've certainly covered most of this already. Just quickly, I'll run through a couple of these slides here, get to some of the meat of the talk. All right, so some background information. So we're seeing a great increase in the amount of medical trainees that are performing global health electives. This is data out of the North American Medical School graduates, showing the increasing rise from 1980 to now, the number of graduating medical students who are participating in global health electives. And similarly, we're seeing opportunities being made available in many medical specialties. This is data from family medicine, emergency medicine, and pediatrics, showing that there's a great deal of interest and enthusiasm for allowing for global health imaging electives in many other specialties. The data from radiology, as I showed you over there, is less than 1%. That's actually just from data that we're going to publish shortly, but I'll show you some of that now. So we conducted a global health imaging survey. This was born out of the fact that I was inspired to be a physician based on my global health experiences. And I was sort of shocked that becoming a radiologist would preclude me from doing this in the future. And I felt that there was a lot of other residents that felt just like me. In fact, many of my program who are here today also are interested in performing international medical outreach using the specialty of radiology. And so we sent out a survey through the program director's listserv and asked them to forward the survey to their residents. And what we wanted, it was a 35-question survey, but I'll just show you a couple of the highlights. Number one, we asked if they had prior experience in global health. And about 30% or so said they did, and that's in keeping with the national rate, generally speaking, of graduating medical students who have been on global health electives. We asked if they had future plans to participate in global health, and this was the interesting thing. So these are radiology residents, people that you would think that there are, since there's so few opportunities, would be the least likely to want to plan to do this in the future. And yet 60% of those that responded were planning on doing some sort of international outreach in the future. Then we asked whether they'd be prepared post-graduation. So if you continued your current medical training, would you be prepared to perform international outreach and imaging? Because as you know, I mean, we could get the images from all over the world, but a lot of us don't even know the differential for a lung nodule in sub-Saharan Africa. We may know what it is here, but that doesn't do us much good. And so these residents, 40%, were the only ones that thought they'd be well trained with their current program. Finally, we asked whether if there was an elective available to them, would they participate? And as you might expect from some of the earlier responses, a great deal would be likely or very likely to participate. And finally, again, so we asked whether or not if there was a global health elective available at a certain radiology training program, would they choose to train at that program over another based on that fact? And surprisingly, it was even a factor in a small amount for 40%, and 20% thought that it would actually do some, it would actually make a big factor in their decision. So the question is now, well, you know, we're showing that there's a great deal of interest among medical trainees and residents in global health. So we want to know what has been going on in the past 5, 10, 15 years with regards to radiologists going abroad and doing imaging. So I'm going to show you 3 examples. Now this is as high-tech as I get. I use stick figures actually to show my, to make my point. So the first example is a resident who probably got a travel grant somewhere. Maybe they found an institution around their home campus that had an elective maybe through internal medicine. And the quote from these residents, and you know, they go abroad and they're not able to do much in the way of clinical interpretation. Maybe it's an observership. And most of the time, they're able to appreciate the lack of resources in the developing world and how good we have it here. And that's one example. And this is the most common sort of experience that radiology residents have had in the past. The second, this is a resident who's maybe a little bit more aggressive. So this resident maybe gets a machine donated, maybe an ultrasound machine, maybe in this case, and goes out. Again, all he does is get a travel grant, so there's no difference. But with his travel grant, he's actually trying to implement a new program, at least during the month that he's on site. So this resident is actually taking an extra step, and this is a quote from a resident who did something similar to this. He actually was able to show a group of clinicians how to do new ultrasound-guided procedures, something they weren't able to do before. And the third example, I've only been able to find one example of a resident who did this. With the same amount of time, this resident went to a program, found that the local radiologists had a great difficulty dealing with archiving their prior films. So he used an innovative use of digital photography and systematically went through the clinical cases and was able to, with a large group of volunteers, put them on a computer, allow them to have easy access, basically a homegrown PACS. And that was sort of what he started, and now as an attending, many years later, he actually has a communication capability with that hospital. So this brings me to something called the Dodo-bird. So, I had a difficult time understanding why all these residents who essentially got the same grant to do the same thing came out with markedly different experiences. And there's a term in the psychological literature called the Dodo-bird, and basically it's from a story from Alice in Wonderland. And at some point in the story, all of the characters become wet. And the Dodo-bird, upon seeing this, he said, well, we should have a contest. We should have everyone run around the lake until they get dry. So everyone thought, oh, that sounds good. So everyone started running around the lake, but no one bothered to measure how far they ran, how long they ran, how fast they got dry. And so at the end, everyone came up to the Dodo-bird and said, so who won the contest? And he said, well, I guess everybody's won, and all of us have prizes. So that's not the right approach. Is what I'm trying to do. What we've been doing is essentially we've been doing a Dodo-bird version. We have the wrong goal in mind. The goal has only been to travel. And I think that instead, we should have metrics to gauge what's being done on the ground. We need to measure what's happening when the residents are there, not just to get them over there. So the metrics would include sustainability, making it mutually beneficial, and of course making it scalable, so we can learn from the experiences of residents who've gone places already. I mean, the issue is that someone may have an innovative idea, but I may never find out about it because when I go on my trip, I didn't hear about it. And so there needs to be a centralized organization that is responsible for these metrics. And I propose a global health imaging curriculum to do this, and basically has three main components. Number one, of course, being education. And this could be in the form of didactic or online education models, and it would be formed around a core elective rotation to serve as the backbone of the curriculum. Project development is the most important part of what I'm trying to put out here today, because this is the deliverable for receiving the grant for going overseas and actually doing something. It could begin with a needs assessment, such as the radiology readiness tool, but it could continue on as a cooperative implementation for many years. And that's one of the key factors of having a difference between just traveling and actually accomplishing something on the ground. And the last, of course, is the research component. So forums like this, where we can have residents present what they've done, and have peer review for some of the journals, like the JACR publishing our white paper, to get the word out there for other groups trying to accomplish similar things. So a form of curriculum, I believe, needs to be certified by a national society. I've talked to you about the complementary components. I think sponsorship, of course, is important, and that would be ACR, RSNA, for instance. Even industry could sponsor something like this. And then these are the metrics that the ACGME typically requires of any program who's looking to train residents. And so I think a centralized organization can manage these components fairly well, given all the tools that we have at our disposal. Just a quick brief word about the online component. Zana showed you the LMS architecture that RAD-AID is trying to put together. The thing to emphasize is that it can have formal and user-generated content. I'll just show you that really quickly. So you heard Brad Shore talk about the imaging of tropical diseases. This is a textbook, a 1,700-page textbook that's considered the Bible of developing world imaging. It covers these main topics, which it's comprehensive. But in the foreword, the authors mentioned that both of them are retired, and they really hope that in the future a new generation will pick up what they've done and carry it forward. And so, a humble suggestion would be up this list here of how we could potentially expand some of the work they've done. It wouldn't necessarily need to be in the form of a textbook. This could be content that could be generated even by a radiology resident. I'll show you how that might happen. So let's take Zana, for instance. We've seen him speak already. He could give a lecture. That'd be great. You've seen me talk. I'm okay. You can see me talk. But the best person to have talk would be Helmut Diefenthal, who we've just heard about how amazing his work has been in Africa. Why not have a resident who's been over there capture his lectures, because he gives 2 lectures a day. He's 85 years old. He gives 2 lectures a day. This is a lecture I captured from when he was at Duke about a month ago. And have his knowledge being easily accessible online. And this would be a way to make his 20 years of work in Moshi, Tanzania more relevant for those learning radiology in his country and for residents who are planning to go over there. So you have some background in the imaging appearances of certain diseases in that country. Just really quickly here, I think that these need to be, the elective rotation itself needs to be certified in some way, to give it some legitimacy. I think that qualified attendings could supervise this experience, and I think there are many that are willing to go, even in this audience. The ACG competency-based goals, I think this has been talked about already, and I'll show you a slide that I've covered some of this. A crucial component then is residency review committee buy-in. The reason why that's crucial, I think, this isn't going to gain any real momentum until we have the powers that be agree that this is an important priority. And maybe a gesture could be counting the number of cases or the number of hours or perhaps the number of procedures during these experiences towards eventual certification. And these are the 6 competencies and how the global health imaging application, the elective would fulfill them. And just a word on the project development again, the deliverable requirement I think is key to making this a successful, sustainable model. And the nice thing about having a centralized organization is that projects that are similar going on in other countries could leverage the experiences of other projects. For instance, a mobile project in Haiti could also have a lot of similarities with a mobile project in India. And so a resident working on similar longitudinal projects in that fashion may have a lot to learn from each other. And again, of course, ground-up development, I think this is important as well. Most residents, we go to work and we see images appear on the screen. We don't have a great deal of grasp of how those images get there. And so, you learn the background of how a radiology department is truly built through projects like this. So where would we go? You've seen how we've been to China, India, and Haiti, and these three countries all have sites that would be very suitable for having a radiology resident rotation. Partners from Project Hope, certainly they're in 35 countries, that's an option. And through residents who are part of RAD-AID, their home institution usually has institutes that have sites all over the world that perhaps could serve as pilot programs for this sort of idea of elective rotations. Just the last thing about research we mentioned, I think we covered in the public health talk how important the research is. So this is my last slide, just about how the model works. So of course the central component is improving the local center and population. It begins with our curriculum. So the resident has a research project or some sort of design that they're planning on implementing upon going to their elective. They participate in the on-site elective maybe after getting online and learning about the disease processes in that country. They come back, they complete the project, and whether or not that's the radiology readiness assessment, or whether it's something more substantial like a lecture or a concept for the curriculum. And then you're able to add that to the curriculum, and that cycle sort of sustains itself. So all those residents that have gone to Moshi, Tanzania, I can learn about everything that they've done through online content that they're contributing to the curriculum. And even better, they could give me cases, all those thousands of cases that they mentioned earlier. It'd be excellent to have those up on the curriculum. And so residents joining them would be well prepared for that experience. And that's it. Thank you very much.